Hi Josh, it's nice to see you guys again. How are you feeling? Any pain or concerns you guys have?
I'm okay, but we have lots of questions about what to do at home with our baby. My brother had his baby last year who passed away from something called SIDS, so now we're both concerned.
Oh, I'm sorry to hear that. What do you guys know about SIDS?
We don't really know much about SIDS, but we want to make sure we do everything we can to prevent it.
Okay, I can help you with that. Do you think now is a good time to talk about this?
Yes, we would really appreciate it.
So, SIDS stands for Sudden Infant Death Syndrome. It is the unexplained sudden death of healthy infants less than a year old. It most often occurs during sleep.
So what causes SIDS?
There's no specific cause of SIDS, however there are risk factors that could increase the likelihood of it occurring.
Is it a genetic thing?
History of a sibling or cousin experiencing SIDS is one risk factor. Additional risk factors are age, race, gender, sleeping environment, secondhand smoke, maternal factors, and physical factors.
Should we have the baby sleep with us then? That way we can watch him all the time and make sure he's okay?
During the first 6 months, we do recommend that babies sleep in the same room as the parents, but in their own cribs or bassinets. You shouldn't share a bed with your baby.
Oh, okay. Should we keep him all bundled up and have extra blankets around him to keep him nice and warm?
That's a good question. Another prevention tip is to make sure that your baby is bundled up, but you don't want to keep him too warm. Do you know the general rule of thumb to keeping your baby warm?
They should be really bundled up in 2 blankets?
That's a good answer. Generally, we like to tell parents that their baby should be wearing one more layer than the parents in the same temperature.
So if we just cover our baby in a loose blanket, he'll be cooler, right?
We often recommend that babies should be swaddled up or in a sleeper. There shouldn't be any extra loose blankets or other items like teddy bears around that the baby could get trapped in.
Okay, so we bought some pillows and extra soft bedding for the mattress for our baby. Does that mean we shouldn't use them because he could get trapped in them too?
Yes, exactly. Using a firm mattress with no extra padding or any loose items. You guys have got the hang of it. Can you think of any other prevention tips?
Well, we know that babies are supposed to have tummy time. Can we let them sleep on their tummy then?
I'm glad you brought that up. Tummy time is important, but only when babies are awake. Having babies sleep on their back is the best thing.
Okay, I think we feel more comfortable now.
Perfect. Do you guys have any other questions that I could clarify for you?
No, not right now, but just to recap, some of the risk factors for SIDS are genetics, sleep environment, and smoking, right?
Yeah, exactly.
And other things we can do to prevent SIDS from happening is to let our baby sleep in our room but in his own crib on a firm mattress with no loose items like pillows, stuffed animals, or things in the crib that he could get tangled and trapped up in. And we also want to make sure that the room isn't too warm, but it's warm enough for our baby.
Exactly. Do you remember the rule of thumb for keeping your baby warm?
Yes, he should be covered up in one more layer than us in the same temperature.
Perfect. You guys will be just fine. This is also a pamphlet if you guys want to look back at it for information or reminders about SIDS.
Thank you so much for taking the time to teach us about SIDS. We really appreciate it and feel a lot more comfortable now to go home.
You're very welcome. If you guys have any other questions or concerns once you're home, just call or ask your doctor.